Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Care of clients under emergency situation. Behavioral emergencies. A situation in which the patient exhibits behavior that is unacceptable or intolerable to the patient, family, or community. 1. Violent patients. Violent and aggressive behavior is usually episodic and is a means of expressing feelings of anger, fear, or hopelessness about a situation. Assessments includes the following. Assess for overactivity, aggression, or anger out of proportion to the circumstances. Determine risk factors for violence, including intoxicated with drugs/alcohol, going through drug or alcohol withdrawal, acute paranoid schizophrenic states, acute organic brain syndrome, acute psychosis, paranoia, or borderline personality. Obtain psychiatric assessment. Interventions includes the following. Goals are to bring violence under control and protect patient and staff from harm. Establish control by doing the following. Keep room door open and be in clear view of the staff. Help the patient bring violence under control. Give patient space. Do not make sudden moves. Avoid touching agitated patients or standing close. Ask if she has a weapon. Request that it be placed in a neutral area. If the patient will not surrender weapon, leave the room and allow security personnel/police to handle the situation. Try not to leave the patient alone. This may be interpreted as rejection or the patient may try to harm self. Adopt a calm non-confrontational approach and remain in control of the situation. External calm and structure may help the patient gain control. Provide emotional support. You can achieve this by doing the following. Talk and listen to the patient. Crisis intervention is best done with an attitude of interest in the patient's well-being and with an attempt to tune into the patient while remaining firm. Acknowledge the patient's state of agitation. For instance, I want to work with you to relieve your distress. Give the patient the opportunity to ventilate anger verbally. Avoid challenging the delusional state. Try to hear what the patient is saying. Convey the expectation of appropriate behavior and make the patient aware that help is available for him to gain control. Administer prescribed tranquilizer to reduce anxiety and hyperactivity. If verbal management techniques fail, to attenuate the patient's tension. Secure assistance by doing the following. Allow security personnel/police to intervene if patient does not become calm. Use a safe room with a locking door and camera surveillance. Use restraints when absolutely necessary, but with minimal force. Have a specific plan and enough well-trained personnel available when applying restraints. If patient is intoxicated, restrain in a left lateral position and monitor closely for aspiration. Talk reassuringly while applying restraints. Use empathic and supportive verbal interactions. Monitor patient continuously after restraints are applied. Check circulation of restrained extremities. 2. Rape and violence. Rape is defined as unlawful carnal knowledge of a female forcibly and against her will. Carnal knowledge is defined as penetration of genitalia, no matter how slight, by the penis. Rape is also committed if intercourse occurs while the female is sleeping, unconscious, or under the influence of alcohol or drugs. A male who is sexually assaulted is sodomized. Sodomy is oral or anal penetration. Violence is the acting out of the emotions of fear and/or anger to cause harm to someone or something. It may be the result of organic disease, for instance, temporal lobe epilepsy, psychosis, for instance, schizophrenia, or antisocial behavior, for instance, assault, murder. Family and intimate partner violence, IPV, is a pattern of coercive behavior in a relationship that involves fear, humiliation, intimidation, neglect, or intentional physical, emotional, financial, or sexual injury. Although men can be victims of family violence and IPV, most victims are women, children, and older adults. Symptoms of survivors include nightmares/sleep disturbances, panic attacks, irritability/anger, difficulty concentrating and focusing, impaired memory/memory loss, sexual dysfunction, phobic/compulsive behaviors, hypervigilance, always being on your guard, exaggerated startle response, depression. In the emergency department, you need to screen for family violence and IPV. For instance, do you feel safe at home? Is anyone hurting you? Routine screening for this risk factor is required. The sexual assault nurse examiners, same. Nurse provides expert emergency care, collects and documents evidence, participates in staff and community education, and advocates for sexual assault and rape victims. Initiate appropriate interventions for patients who you suspect or find are victims of abuse. These include making referrals, providing emotional support, and informing victims about their options. For instance, safe house, legal rights. Thank you for listening. Have a good day and be safe. Agyamanak.